Why do some doctors hesitate to treat Lyme disease? I see this often. And the truth is, physician reluctance in Lyme disease treatment can sometimes cause more harm than the treatment itself. Today I want to talk about why this happens, what it means for patients, and why weighing risks versus benefit is so important. Picture this. A patient walks into the clinic with classic Lyme symptoms and a clear exposure history. The test is negative, but we know early Lyme disease tests can miss up to half of cases. The physician hesitates. Maybe it's concerned about guidelines, maybe fear of scrutiny from medical boards, or simply uncertainty about how to move forward. This isn't about the lack of compassion. It's about professional pressure, conflicting recommendations, and a fear of getting it wrong. But while the doctor hesitates, the patient suffers. So why does physician reluctance in Lyme disease treatment happen? First, liability concerns. Doctors worry about scrutiny from insurers or medical boards. Second, conflicting guidelines. Some recommend a very narrow approach, while others support a more flexible care. Third, limited training. Many physicians simply don't learn about the complexities of Lyme disease in medical school or residency. And finally, insurance pressures. Extended antibiotic care is often denied, putting doctors in a tough position with their patients. The impact on patients is real and often devastating. When treatment is delayed, infection can spread to the joints, heart, and nervous system. What might have been straightforward to treat early becomes far more complex later. Patients describe the emotional toll as worse than the disease itself, feeling dismissed, doubted, even abandoned. One patient told me, by the time anyone finally treated me, I had already lost 2 years of my life. That kind of medical trauma can linger for years. Let's talk about the risks. Every treatment carries some. With Lyme disease, antibiotics may cause side effects, gut imbalance, or a temporary Herxheimer reaction. These are usually manageable in short term, but the risk of no treatment, they're far greater. Permanent neurologic damage, disabling arthritis, heart rhythm problems, even sudden cardiac death. When we weigh these, honestly, supervised treatment is often the safer option. The greater danger is hesitation and inactions. So how do we move forward? First, through shared decision-making, having real conversations about risk and benefits. Second, by individualizing care, tailoring treatment to each person's need and medical history. And finally, by supporting physicians so they don't feel punished for making reasonable clinical decisions. Reluctance may feel safer for the doctor, but in Lyme disease, inaction can be far more dangerous for the patient. The best medicine is thoughtful, evidence-based care that puts the patient's welfare first. Have you experienced delays in care because of physician reluctance in Lyme treatment? I'd like to hear your story. Share it in the comments below. Your experiences help other patients know they're not alone.